what we just did, all right, because Lee has this, it's called idiopathic sciatica. We assumed it's coming from this L5S1 joint, which is basically collapsed. I mean, if you look at the MRI or X-ray, it looks like it's stage 4 bone on bone. It actually looks like a compression fracture. He didn't fracture it. What happened? Because he has a little osteoporosis, the bones got weak and the vertebra just collapsed, all right? So we're assuming that the sciatic nerve here, which is between L5S1 and the disc, is entrapped or compressed. So you would assume he does have low back pain, which he really doesn't. The pain is more like in the SI joint here, okay? So what I did is the shockwave machine, which sends acoustic waves of energy, it actually brings out the pain and inflammation, which you feel. And there were 3 points the shockwave discovered. He does have pain in the right L5S1, the sacroiliac joint, which is, that's where the sciatic nerve runs by, and then the hip right here. So these 3 areas is where we put 30 million umbilical cord blood cells to decrease the pain and inflammation. And we put ozone gas because each joint has what's called a capsule. We want to kind of pump air in your tires literally to decompress the pain, the pressure off the sciatic nerve here at the L5S1 juncture, where it passes through the piriformis muscle, the SI joint, and the hip, because you have this lateral femocutaneous nerve causing that lateral knee pain. All right. And now we're going to follow up with just some shock wave, just to kind of, you know, decrease more pain and inflammation in these 3 spots. So I think, you know, this will give you at least temporary relief until you get more, you know, more cells. Probably have to do something for the hip because you see the hip x-ray is kind of down like that. Might have to do another shot there. But I think, you know, you're getting a tremendous relief just doing those 3 things: the shock wave, the ozone, and the umbilical cord blood cells.
On the